I already hit record.
Oh. Hey there, my name is Casey Blake. This is going to be our NG tube insertion and suction and lavage and gavage. So first we're going to do the 12 safety practices. First I'm going to verify my order, which I have right here. Second, I'm going to perform hand hygiene before and after procedure and handling equipment and whatnot. Second, I'm going to confirm the company's policy and verify all that. After that, any equipment used, we're going to check the manufacturer's instructions, consult manufacturer instructions. Then we're going to knock before entering the room. We're going to identify the patient using two patient identifiers. Usually we're going to ask them to say their name and date of birth. We will check their ID wristband. Once that's done, I'm going to note the overall condition of the patient. I'm going to explain the procedure being done to them. I'm going to elevate the bed for good body mechanics. Then I would don on PPE, the necessary PPE for the procedure. Upon completion, I would lower the bed, lower the side rails, or raise side rails, just depending on what the order is. If there's any abnormal findings, I would report and record to the my charge nurse. So for today, I have my orders for Mr. Bob Bob G. He wants to, we first have to do an NG tube for him, and then we have to do intermittent suction after that. So I would knock before entering the room. Hey Bob, my name's Casey Blake. I'm going to be inserting an NG tube today. Can you tell me your name and date of birth? Okay. And then we're going to check your ID wristband. That matches against the orders. So you're doing the NG tube. I'm going to perform hand hygiene. Once I have that done, I am going to lower your bed and put you in supine position. I hope you don't mind, so I can listen to your bowel sounds. I'm first going to elevate your bed, then we're going to lower you. Okay. It'll just be real quick, nice and easy. So when you inspect the abdomen, you first want to look, and then you want to listen, and then you're going to palpate, because if you palpate before, you could affect the sounds of the bowel sounds. So you don't want to get a false reading. Okay, now that that's lowered, I'm just going to look. He has a nice flat abdomen. I'm going to listen now. See what kind of bowel sounds. Okay, so he is normal active in all quadrants except for his lower left. So once I've done that, I am going to raise him back up into semi-Fowlers for the procedure. And then we're going to assess his face. We're going to assess his nasal cavity and his oral cavity to make sure the nasal cavity is patent. We're going to look for any deformities or we're going to look at a soft palate and hard palate, make sure we don't have any deformities there. Okay, so for this I am going to put on gloves because I am going to be touching, I'm going to be around his oral mucosa, so don't want to contaminate everything. I'm going to put my table over here so I'm not reaching and I'm constantly just in his area, in our area. I'm going to raise him up a little bit more. Now I'm thinking about it. So I have my pen light. I'm going to need a pen light. So observe. So first I'm going to look in his nares just to make sure they're patent. I don't see any blockages. If I were to see anything, I would ask him to blow his nose and clear his airway. Next, we're going to check in his mouth. I'm going to use a tongue depressor. So normally his pillow would be behind his head, but okay, so I'm going to look. Everything looks clear. I don't see any deformities or anything that would interrupt the gastric tube or the NG tube. So once that's done, I'm going to set this aside. I would throw this away. I'm going to throw away my gloves again. And then we're going to start getting set up for the NG tube. So got that, wash hands, get my packaging and my equipment. Everything is, this is not opened, it's all in date. So we are gonna, I'm just gonna open everything up a little bit. I don't really have to open that one up, but I'm gonna grab my tape and I'm gonna lay down some tape first. This procedure is a clean technique, but just to be safe, and I wouldn't want anybody putting any funky tape on my, we're gonna put tape down. Then we're gonna tape it up. One piece of tape, we are going to do little britches on him. It'll help secure the NG tube around his nostril. Okay, I'm going to set this tape right on there. So I have my tape set. I'm going to put gloves back on. We're going to open up our Salem pump because that's what we're using today. And we are going to first measure the tube, and we'll mark our measurement. So we'll open this up. I'm going to lay down this drape for him because this procedure can get a little messy. It's going to, you know, his eyes are going to water. He could start to just get messy. You want to offer tissue. You want to offer a glass of water for when we're swallowing the NG tube, just for comfort. Because this procedure is definitely not very comfortable. So we're going to start with the tip, and we're going to do at the tip of his nose to his ear, and then we are going to measure down. I'll replace the drape. Measure down to the end of his xiphoid process. So we're going to mark right there. It's right at about 55, about 53, 55. I am going to do a piece of tape to mark my place because that is where we want to insert it. That's where we know it's going to be reaching the stomach. And now that I have it taped, I am just going to coil it around my hand just to kind of open up the flexibility of this procedure, of the tubing. Now that it's flexible, I'm going to insert the first 3 to 4 inches into a thing of lubricant, which this is lubricant, water-soluble lubricant, because you don't want to use oil-based because it can break down the tubing. And water-soluble is just, it's going to be a lot nicer on his stuff too. So we put it in there, let it sit. You really want to make sure it is lubricated because it's just going to make things run a lot smoother. So first, this is as high as he's comfortable going. I know it's not 100, like right at 90%, but it will work for this procedure. We're going to ask him to tilt his head back. Once he feels a tickle in his throat, we are going to have him move his head forward and take sips of water to help advance the NG tube. So with his head back, we are going to ask him just to be comfortable. This procedure is going to be a little uncomfortable. So before I would insert it, we would make a sign. So with his left hand, he would give me a thumbs up. If the procedure becomes too much and he just needs a break, I would just back out the tube just a little bit, and then once he feels comfortable, we would go on and advance again. But if it becomes too much, where like he's starting to gag really bad, we would just stop, pull everything out, and we would start over once he's comfortable doing so. So, with his head pulled back, we're just going to slowly insert just a little at a time. Oh, friend. There we go. If you are met with some resistance, we're going to wiggle. We'll turn a little bit and then keep advancing. So once he's saying that he feels the tickle in the back of his throat, we're going to tilt his head forward. If he is able to, let him hold the water. If he's not, we would have someone here to help. So as he drinks, takes a sip, and swallows, we will advance. Okay, this mannequin, he's being a little stubborn. Normally his head would be tilted forward as he takes a sip, and like we would slowly advance, but he takes a lot better if his head's back. So we would just slowly insert, and then he would take another sip. We would insert, take another sip, insert, and we would keep doing this process until we reached our flag mark. So we'll see if we keep going. So he's stopping right here. In real life situation, it would not, if we were met with a stoppage like that, we would slowly back out a little bit, let him take a drink of water, and if we still couldn't advance, we would probably end the procedure and just start over. Since this mannequin, he will not take any more, we're going to stop, but normally we would advance all the way to here. So I'm going to take a piece of my prepared tape, and we're going to tape across the bridge of the nose. I'm also, during the initial assessment, I would want to check for any, don't want to put that over your nostril, Neil. I would check the skin to make sure it could, the skin integrity, to make sure that it would be okay with tape. We would also use silk tape because that's a lot easier on the skin instead of this tape, but I don't have silk tape. Sorry, guys. I'm going to do this right there. My last piece of tape and just place it right over that to just extra reinforcement, extra securement. So now that that is taped, we are going to check the pH to see if we're going to check the pH level. So I'm going to clamp this up because we don't want any, I don't want to clamp that up. We don't want any air to get into the stomach. So I have my package open. I'm going to grab my syringe. I'm going to replace the stopper. Insert syringe. You don't want any air to get in there, so we always want to close our ball first and insert, and then let the natural suction suck it up. So we have our pH, so then we would, I would have unclamped it. So once it filled back up, we would just twist off. I would put the secretions in a little cup. I have my pH strip. I'm gonna test it, read it. As it's less than 5.5. We're in the stomach. I will replace my stopper, and then I am gonna secure. So normally we would take a rubber band and a paper clip or a safety pin, but we do not have that right now on hand, so we will just tape it up. But normally, in real life, I would be more prepared. So we're going to tape this up. If he would have needed to, any care, any drainage, or like to wipe any tears and whatnot, because this is going to make your eyes water. It's just involuntary reaction. we would have cleaned him up. Once I've secured it, that's when we would do the x-ray, the chest x-ray, to make sure that it is in place and everything is good. I would ask him how he felt during the procedure, see if he had any reaction, like if it was any abnormalities. I would discard my gloves. I would clean my supplies, discard gloves, wash hands, and then I would document my findings. So I'm going to document the type of tubing I used, what size I used. I would document which nostril I used to insert. I'm going to document my insertion, and then we're going to do on to suctioning. I would document the pH balance, the secretions, and the consistency of the secretions that I had withdrawn. So once I've documented everything, we're going to do the second part of that first order, and we're going to do the suctioning. So I'm going to come in. I would knock before entering the room, name and date of birth, check wristband. I would wash hands, put on a new pair of gloves. I would tell him, like, hey, you are ordered for low intermittent suction. So we're going to do that today. So I'm going to come around to this side over here where the suction canister is. I'm going to trace my line right here. Trace it, make sure it's over there. Okay. So then I'm going to attach it, and then I'll be right back on that other side. So I would want to, I'm going to unattach him because every time you do anything with an NG tube, you want to check the pH balance. Just check the secretions of it to make sure it's still in the right place. So that's what I'm going to do real quick. So I would suck, insert, new pH strip, check it, make sure, okay, we're still in that acidic stomach range. So what I'm going to do next, I would unclamp it before when I'm getting secretions out. So I'm going to attach it, the line, it matches up to there. We traced it back. I would clip his tubing back on to his shirt. So now that we're attached, we're gonna go back over here. And so it's asking for low intermittent suction. Usually the range for that is between 80 and like 120. So I'm gonna just set it to 80. So I'd move my dial to set. And then we're going to turn it on to the intermittent suction side, and we would let it go. So I'm just going to turn it off because it's not going to suction anyway. But we would monitor that. We're going to check the secretions in this. Normally we would, at the end of a shift or anything, we would document, put like a piece of tape, like this already has a piece of tape on it. We would mark where and date and initial, and then we would also report and record those findings, as well as the color of the secretions, the consistency, the amount, all that good stuff. So that way when the next shift comes in, they can, I'm going to put this pillow back because it's bugging me. They can know like if there's any abnormalities or if anything changes that shouldn't be right. Okay. So, upon leaving, making sure the patient is okay, that they tolerated that well, I would gather my equipment, discard my gloves, perform hand hygiene, and then I would report and record everything. Yep. Okay. So, our next order is to perform gastric lavage. So we are going to irrigate his stomach. We're going to irrigate his stomach with normal saline. until the contents run clear. So I'm going to knock before entering the room. I'm going to ask the patient for 2 patient identifiers, so name and date of birth, and then I would also just confirm his wristband, just to be extra sure. Then I'm going to tell him, so today we're going to be performing a gastric lavage. We are going to use normal saline to flush your stomach, okay? So my normal saline, I have this filled up. You want to use room temperature. You don't want to use cold. You don't want to shock their system. So what we're going to do is turn off his suction because it would still be going on. Discontinue. Make sure this is clamped once discontinued. Then we're going to remove our clamp. We're going to first, I'm just going to check the pH of his stomach contents to make sure we're still in the stomach. I'm going to use a new pH strip, check the stomach. Okay, we're still good. We're still under 5.5 and the acidity's still good. So next what we're going to do is we're just going to irrigate the stomach. So we're going to take our little tube, insert. We're going to take our normal saline. So this container contains 500 cc's. So we would fill it up. I'm going to put our tray right here too. We're going to fill it up, and then this can only take 60 cc's. So we're just going to fill this syringe up. So we're going to pour our water in, or our normal saline in, and then once it's filled to 60 cc's, we're going to unclamp and just let it flow naturally. Make sure all the kinks are out. We're going to let it flow naturally. You don't want to get above 18 inches above their stomach because then that can be too forceful with them. So once it gets to about right down there, we're going to clamp it off to prevent any air from it getting in. Or, I'm sorry, we're not going to do that. We're going to let it go, and then we're going to drain it. And just let natural gravity, everything naturally go. And then we're going to clamp it off, and then we're going to flush it again with another 60 cc's. We're going to unclamp and let that drain, and then once it's drained, we are going to drain, and then we're going to clamp it off. And so on that return, his stomach, it was the contents ran clear on that one, so we've officially irrigated him. So we are going to, we're going to note the contents of this. We're going to note how much we got out of that irrigation. We're going to note the color, consistency. We're going to document how the patient tolerated that. We are going to, of course, we're going to look and make sure he's not in any signs of discomfort. The tape, the securement device is still intact. It's not irritating anything. We would perform oral care. So we're going to replace this. And we're going to put the stopper, and then we're going to attach the securement device again to his shirt. And then we would report our findings. So I would gather my equipment. I would take my gloves off, perform hand hygiene, and then report and record everything. So next we have administer Glucerna. So we're going to feed him. We're going to perform a little bit of gavage today. So I would, not before entering the room, ask the patient to give me 2 identifiers, so name and date of birth. I also like to check the wristband as well. And then, so today we're going to be, we're going to do some feeding. We're going to do a gavage. So I would perform hand hygiene, put on my gloves. So I have my H2O, my water, so we're going to be flushing before and after administering his Glucerna with 25 milliliters each. So I have that. I have my Glucerna, so before I do anything, I'm going to make sure it's intact, it's not expired. I want to wipe off with an alcohol swab the top of it, and then shake it, or you would let the alcohol dry, shake the contents, and then that's when you would open it and administer. So he gets 100 cc's. Yeah, I'm sorry, 100 milliliters of this. So first thing we do is we're going to aspirate his stomach contents. So we have our little I'm going to unhook your safety device, okay, Mr. G? We're going to undo this. So we're going to squeeze our ball. Let it naturally just do that. You would let it go, unclamp it. And then you'd clamp it back. And then you would relieve. Do this. Unclamp. Let it go. Reclamp. Let go. So that's all that's in his stomach. We have 100 return. So we are going to return that. It's good. So we would note the color and consistency of it and the amount we had, which was 100 milliliters. So we're going to take our ball off, maybe. We're going to insert our tube. We're going to take our stomach contents, and then we are going to return. So we would return, return, return. So once it gets filled, we would keep doing this until we got it all. We returned everything. So we would return, return, return. We would clamp it back off. So next we are going to flush. So we have 25 milliliters of water in our little H2O cup. We're gonna put it in there, and then we are gonna unclamp and let it flush. And then once it gets to about right there, we're gonna clamp it back up again. And then next we're gonna move on to our Glucerna. And we're gonna fill it up to 60 milliliters because that's as much as this can take. And then we're gonna unclamp and let it drain. And then once we get down to right about there, we're gonna clamp it back up again. And we're gonna give the rest of the 40 mLs into our feeding tube, and we're gonna let it just slowly, just let gravity take its course, and let it go. And then once it gets down to about that mark, we're gonna clamp it off, and then we wanna make sure we flush it again with the last 25 of ours. So we're gonna let it slowly drain. Once it is drained, we're gonna clamp it off again. If I didn't say this before I started this procedure, I would have checked the stomach contents. I can't remember if I did or not. But anyway, we're gonna attach our stopper back into it now that it's in place. We're gonna attach our safety device back to our Mr. G. We're gonna ask him how he tolerated the procedure. We're gonna ask him, like, how are you feeling? We would perform oral care, because this procedure can be pretty drying out. Just in general, because he's gonna have to get used to breathing through his mouth. You wanna perform oral care more than you would with a normal person. You're gonna check his nose, the skin integrity around his nose. You still wanna just assess and monitor everything. So I would gather my equipment, remove my gloves, perform hand hygiene. I would document my findings. I would document how much normal saline I gave, or how much water I used to flush. I would document how much Glucera I gave him. I would document how much return that we got initially from him, the contents, the color, consistency about that. I would document how well he tolerated the procedure. I would document his pH level again, and if I found anything abnormal, or if I ever felt uncomfortable, or I thought his chest or his NG tube had moved, I would request an X-ray, and that's the whole purpose of having that mark right there, or your marker. Yeah. I would make sure he's safe and in a comfortable position. I would raise his side rails. I would attach his call light after leaving. And